So, antifungal drugs, today's topic antifungal drugs classification, antibiotics, polyenes, echinocandins, heterocyclic benzofurin. Polyenes are amphotericin B, AMB, echinocandins are micafungin and caspofungin, and heterocyclic benzofuran is griseofulvin, and antimetabolites, flucytosine, azoles are imidazoles and triazoles. Imidazole are of two types, topical and systemic. Topical are iconazole, miconazole, and clotrimazole, and systemic are ketoconazole, and triazoles are fluconazole. Now, allylamines are terbinafine, and topical agents are benzoic acid. So that was the classification of the antifungal drugs. So the most important here is amphotericin B, AMB. It is used for serious fungal infections, and here it is drug of choice for cryptococcal meningitis and mucormycosis, and it is given IV. It's very toxic, means its side effects are chills and fever when we give the IV infusion. It's nephrotoxic and does the bone marrow suppression. Now, liposomal amphotericin B, LAMB, it's called LAMB. This is less nephrotoxic as compared to conventional AMB, means amphotericin B. It cost higher and drug of choice for Kala Azar. So liposomal amphotericin B is better. It is less nephrotoxic as compared to conventional amphotericin B, and its cost is higher, but and the drug of choice for Kala Azar. Now, the mechanism of action of amphotericin B. Firstly, we'll see the structure of the cell wall of the fungus. So here we can see this is the extracellular space, and uh, the upper layer there is proteins. Now this is called chitin. It's a constituent of the fungal cell membrane. So it makes the cell wall. Here proteins, chitin, etc. Here we can see a molecule which is amphotericin B. It has two sides, hydrophobic sides and hydrophilic side. As you can see, this inside side is hydrophilic side, and this outside here I am putting an arrow. This is hydrophobic side. So and this molecule, this green color molecule, this is ergosterol. It's a sterol. Now the mechanism of action, it's like that. Amphotericin B is polyene, so it is insoluble in water. So amphotericin B combine with ergosterol and get inserted into the membrane. Okay. Now it forms a micropore. So as I said, it is having two sides, hydrophilic side which forms the interior. Here I am showing you with blue arrow. This interior is formed by the hydrophilic side. Through the ions, amino acids, and other water soluble substances move out. And the hydrophobic side, I'm showing it you with the yellow arrow here. Hydrophobic side, which forms the outer surface of the pore, and this side is stabilized by membrane sterols. Thus, the cell permeability is markedly increased, leading to the death of fungus. Now, griseofulvin. It's a heterocyclic benzofurin. Act on mitotic spindle. Oral oral static oral static drug है. It's T. It's static. I forgot to put. Now, high affinity for keratin, used for dermatophytosis, and we should know the dermatophytons कौन से होते हैं. These are trichophyton, epidermophyton, and microsporum, and you will learn it in microbiology. Avoided in patient taking disulfiram. Next is ketoconazole. its symbol is KTZ, and it is first orally effective broad spectrum. First orally effective broad spectrum antifungal drug. So uses dermophytosis and deep mycosis. Uses are dermatophytosis and deep mycosis. Not much in use these days due to several side effects. Microsomal enzyme inhibition. There is microsomal enzyme inhibition causes gynecomastia, cause adrenal suppression, and it is hepatotoxic. Ketoconazole oral absorption is facilitated by the gastric acidity. So, when we give the H2 blockers, proton pump inhibitors, and antacids, which decrease the gastric acidity, they also decrease the oral absorption of ketoconazoles. Now, fluconazole, maximum oral bioavailability, maximum CNS penetration, drug of choice for Candida and Cryptococcus in their maintenance phase. Adverse effect of fluconazole is nausea, vomiting, abdominal pain, and rash. And next drug is terbinafine. It's allylamine. So allylamine they inhibit squalene. I wrote the spelling wrong. Let me correct it. It's squalene here. Squalene epoxidase, which because of that there will be the accumulation of squalene and toxic to fungal cell. So terbinafine, it's allylamine which inhibits squalene epoxidase, leading to the accumulation of squalene, and it is toxic to fungal cell. So squalene in presence of squalene epoxidase will form lanosterol and further ergosterol. So uses of terbinafine are fungal infection of skin, nail, hair, means the areas which are rich in keratin. That is, it causes dermatophytosis or tinea infection.